Welcome everybody back. I hope everybody had a good summer break with the end of summer. Tonight we're very grateful. We have two young doctors calling us from California, Arevhat&Ani. Thank you for joining us. We have Arevhat with us this evening, Lazoyan, who will be speaking to us about the Rural Development Program, and Shant Sherkadimian, and of course Dr. Arevhat&Ani Armenian, about entrepreneurs in health and the Rural Development Program. These are really amazing programs. And now that we are trying to build our economies back up, entrepreneurs play a critical role. Small businesses play a critical role in getting things started and employing people and bringing new ideas to the marketplace. So again, we want to thank you for joining us. We're now going to begin our program. And Dr. Armenian, are you going to be starting for the group, or who is going to be starting?
Yeah, I'll be starting with the group, and I'll be presenting the background of the Turpanjian Rural Development Program, as well as the entrepreneurship in health, which has stemmed from the Turpanjian Rural Development Program. To start with, it was 14 years BC that Arevhat Turpanjian, most people know him as Jerry Turpanjian, initiated the Turpanjian Rural Development Program. Did you get the 14 years BC? Before COVID. Because COVID is such, and it is going to affect our lives in such a tremendous way that it's going to be the new BC. So the Turpanjian Rural Development Program was initiated in the year 2006. Mr. Turpanjian approached us. I was the president of the American University of Armenia at the time, and he said he would like to contribute to the rural the development of rural development. So the program itself aims to contribute to the sustainable economic development of rural areas of Armenia, Artsakh, and Javakh. In order to do that, we have to create sustainable businesses in the rural areas of Armenia, to increase the overall level of entrepreneurship among the rural population through adult education, and to improve the quality of life of rural residents and enhance community orientation and socially driven behavior among rural residents. Why did we focus on entrepreneurship rather than, like other organizations have done, in doing different programs, comprehensive programs in rural areas? Because we depended on the characteristic of entrepreneurship that Armenians have had all through our history, even during the Soviet Union, there was quite a lot of entrepreneurship in Armenia. Now, the program was launched in 2006. The 5 million donation of Mr. Turpanjian was supposed to cover a 5-year period. Today, we are 14 years and going into 15, and we are using the initial 5 million donation because we moved from the idea of doing the grant program to one of, I'll talk about that, of a loan program. We developed, one of the first things we did was develop an executive committee that oversees the program, from AUA faculty and staff, as well as the AUA extension program. We started with the regional office in Chirag, which oversaw the operations there. The first area that we tackled, because it was the earthquake zone. Then we moved into Davush as the poorest area, one of the poorest areas of Armenia, and Artsakh in 2007, Javakh in 2010, and Vayotsor in 2015. In 2017, about a year or two ago, we started the Entrepreneurship in Health program. Since then we, rather than opening up new offices, we try to expand the program through confluent regions. Like we added 13 new communities in Lori from our Shirak operation, 8 new communities in the Gerarkunik region in the Sevan Lake area from Davush, and 3 new communities in the Ararat region from Vayotsor. The activities of the TRDP, or Turpanjian Rural Development, involve entrepreneurship training course, which was developed and is in constant revision. Currently, we have a new revision going on, depending on the needs of the program and the environment. The AUA Extension Program and the AUA School of Business and Management were the prime contributors of the development of these courses. The objective of the course is to have every participant develop a business plan as the end product of the course. The financial assistance involves, initially, as I said, we started with grants. The first 20 grants that we offer today, we have nothing to show of them, but the program was successful with developing a loan program with a low interest rate that we manage through the banks. TRDP is the guarantor, as well as TRDP provides the Turpanjian Rural Development, subsidizes the difference in interest rates. Also, the part of the and parcel of the program is the monitoring and mentoring of the people involved into the program. We have so far, over the last 14 years, developed 423 businesses that were established. Today, we have 213 of these businesses are continuing, and many of the other businesses that develop have moved into other sectors. For example, if you, initially there was no access to internet, so internet cafes was something that we have a dozen also in various villages through radio connections, etc. Those businesses were, with the access to internet with the interphones or cell phones were the ones which were discontinued because there was no need for them. We have 433 jobs that were created. 1,200 or so people were trained as entrepreneurs, went through the program, developed their business plans, and some of them went on their own and others continued with us. We just finished a survey of about 200 businesses that were able to contact. And out of those 200 businesses that we were able to contact, we just found out that 91% of these businesses that were operational in January of this year, of 2020, are continuing in their operations following this COVID-19 crisis. The impact of the TRDP is, in manifold. Socioeconomic, high quality products and services that communities are being provided with. There is always a ripple effect that we observe, and that is the beneficiaries themselves will help and mentor other non-TRDP businesses. There is a TRDP business network. People in the same classroom over a period of 3 to 4 weeks form bonds that they work together in exchanging things or getting advice from each other. And we encourage socially conscious behavior in encouraging them to do community type of work themselves and develop such projects. And we have many examples of that, particularly in the border regions. What why is TRDP successful? This was a question that they asked me in Lebanon some years ago, because it's a model that was developed locally. We did not, mimic or pick up our model from some textbook or somebody doing something in Ukraine or United States. We relied on our own resources and relied on the abilities of the people that we dealt with. Another factor is the fact that we had at least 5+ years of funding assurance. We did not have to run after funding while we were working on the program. The management of the program had some thing to do with the success. We continued having weekly executive meetings. Every Wednesday morning at 6 a.m. the LA time, those are the executive meetings that people link to from all the 5 regions, as well as Yerevan and others who are on the executive committee. Retreats and conferences, and very important, our local leaders have some level of autonomy, but they report their activities every week in their reports. We have a multidisciplinary engaged faculty. It's not just a business faculty from AUA, but engineering, also public administration, public health, law. Every discipline participates in the management of this program. And we have a well-established monitoring and mentoring system. It's very important to highlight the sense of mission of the people who are involved. They are good persons. The extension program, I mentioned about that. And the other thing that this program does is that we pick up for doing or organizing these courses locally from teachers from local colleges. This way, we think we are improving the teaching in the local colleges by providing the sort of know-how that educational know-how to the local teachers who are involved into our program. We have, as any good management should be, consistency of purpose and operation. We're always yearly and sometimes the half-yearly critique and innovation is part of the activities. The next one is very important, and I've emphasized that this is not a charity project. We work on business merit at every stage rather than on charity. And it's not a university R&D project, although we have got research for the purposes of the project. Public confidence building is very important. Local networking and peer groups, encouraging Armenian cultural trait of entrepreneurship, as I mentioned before. Now, before I move to entrepreneurs in health program, Larry, should I give a chance for questions about TRDP?
I just have a question about the environment that this is taking place in. Is working in Armenia a positive entrepreneurial environment? Are there any impediments that you're running up against? Is there government support for efforts like this? And do you also track entrepreneurial efforts by entrepreneurs not necessarily involved in your projects? So, for example, Shanta Shirkadimian had informed us about the Robin the Robot program, and we met the entrepreneur behind that.
I think there's always something to learn from everybody else. But one of the things that we have tried to stay away from government infrastructure, at least in the previous governments as we have moved away. And that has helped us to be as autonomous, as independent, as enmeshed in some of the problems that would have created for us. But we have good relations in all the regions with the local marsbeds and the local government authorities. Also, governments themselves have realized the importance of this program for their local population. Bako Sahakyan, and this is something I wanted to mention earlier. he would say that whenever I go around Artsakh to the villages and my visits, I identify the people who have been through the TRDP program because of the way they think, because of the way they act. There is one of the things, and this is, I can open a parenthesis if you don't mind, is that there is always diffusion of ideas in the Armenian population. And this diffusion theory, I have to mention, comes from a study that was done by the American University of Beirut, Professor Stuart Dodd in the 1930s. He was a sociologist and he wanted to apply sociometric methods in dealing with problems. Sociometric methods were new at the time in the United States. So he picked up these two villages where he wanted to do a social experiment on health. These two villages in Syria happened to be Armenian villages. And he said the way they did it, they took a baseline assessment of the health conditions in those villages, and they introduced what they called the health culture in one village, and they did not introduce the health culture in the other village. Came back a couple of years later, did a follow-up, did the physical exams and all the health exams and all that. And guess what? There was no difference. The introduction of so-called health culture in one village had diffused to the other village, which was geographically not very far. These two Armenian villages were connecting, and whatever they introduced in terms of new ideas and new ways of dealing with health were so this study has been published in a book by Stuart Dodd, whose father was a missionary in Talas in the early 20th century, late 19th century. So diffusion is something that we have to bet on when we are introducing new ideas, new concepts, and even the virus itself. The polio virus, oral polio vaccination relies a lot on the diffusion through the feces in developing countries to the kids who did not get the vaccine. For years, as a public health person, I've been concerned with the way the healthcare is delivered in Armenia, and all the efforts that have been done, particularly in rural Armenia in healthcare, have not really proven to be successful. Millions have been spent by USAID, World Bank, and others, but they relied on the old Soviet model. They relied on the old Soviet system. And then they tried to infuse all their funds and technology into those facilities. One of our TRDP entrepreneurs, a physician from the town of Bert, he developed one project with us, which was basically a cafe, a bistro in Bert. He came up with the idea and proposed to develop a medical laboratory in Bert, which is at the border, Shamshadin, and was recently involved in the shelling by the Azerbaijanis. Dr. Hmayak Adamyan developed this lab. It became a success story both on the business side, but also on the services side, because he had one business model, simple business model. He said no test or laboratory test will cost more than the trajectory that it costs from Yerevan, from Bert to Yerevan to go and come back for the test, or to the nearest town where the test is available. And overnight, he provided a high quality laboratory in Bert, which the government had not been able to do for decades. So this idea itself encouraged us to think about this model to think about developing private practices in the rural areas using the facilities and the program model that we had developed with the Turpanjian Rural Development Program. We are providing currently the following 4 different types of courses to different groups who are engaged in rural practice. The entrepreneurship skills course, which ends up in a business plan. They come up with their own idea of what sort of practice they want to do. They develop the business plan through that course. Then they have the basics of healthcare quality management course, the result of which is the quality assurance plan that will be serve as a monitoring, self-monitoring, as well as external monitoring tool. Then we also have a healthcare accounting course, as well as recently we have developed a preventive dentistry course. I'll come to that in a moment. We have a dental hygiene program, which fills in an important area that is lacking in the practice of dentistry in Armenia. There is very little of dental hygiene and dental preventive dentistry in Armenia in the clinical environment. I think this is the last slide because we're going to show the video which is in Armenian, but most of you will be able to capture much of that video. Currently, we have very successful these 7 different clinics, the pharmacy in Hakhtanak village, family medicine clinic in Noam Perian Down, pharmacy in Sevkar, medical center in Bert Town, dental clinic in Sevan Town, family medicine clinic in Dalin Town in Arakazodon region, and dental clinic. And we have got another half a dozen of practices which are in the process of development. And you can go through the AUA website to get much of the information on these programs. I'll stop here, and then I will let probably Astrid Grande film before we get into another question and answer session. Astrid is one of our star graduates of our MPH program. She is an MD from Yerevan State Medical University.
Հայաստանի ամերիկյան համալսարանի ձեռներեցներ առողջապահության ոլորտում ծրագիրը Թրփանջյան գյուղական համայնքների զարգացման ծրագրի ընդլայնումն է։ Այն նպատակ ունի օգնել առողջապահության ոլորտի ներկա եւ ապագա ձեռներեցներին սկսել կամ ընդլայնել իրենց մասնավոր գործունեությունը, այդպիսով բարձրացնելով որակյալ ծառայությունների հասանելիությունը ինչպես Հայաստանի, այնպես էլ Արցախի եւ Ջավախքի մարզային փոքր քաղաքներում եւ գյուղական համայնքներում։ Ձեռներեցներ առողջապահության ոլորտում ծրագիրն ունի հիմնական մի քանի բաղադրիչ։ Առաջին եւ ամենակարևոր բաղադրիչը ձեռներեցների համար անհրաժեշտ հմտությունների եւ գիտելիքների տրամադրումն է։ Բժիշկները կամ բուժաշխատողներ առողջապահության ոլորտում, որոնք ուզում են իրենք իրագործեն իրենց բիզնես գաղափարը, մենք իրենց զինում ենք այդ գիտելիքներով, բիզնես հմտություններով, որպես իրենք կարողանան ճիշտ ձևով կազմել իրենց բիզնես պլանը եւ իրագործել այդ բիզնեսը։ Դասընթացներն անցկացվում են հայերեն լեզվով, անվճար են եւ հիմնականում իրականացվում են Հայաստանի ամերիկյան համալսարանում։ Աշխատել եմ տարբեր կլինիկաներում, մինչև այն պահը, երբ որոշեցի իմ առանձին կլինիկան ունենալ։ Ինչ բիզնեսը սկսել է, իրանք արդեն նախապատրաստում են քեզ, որպեսզի դու կարողանաս հաղթահարես
այն դժվարությունները, որոնք կհանդիպեն քո ճանապարհին։ Այսինքն մենք այնտեղ անցնում էինք աշխատողական բիզնեսի դասընթացներ, ինչպես նաև ամենակարևորը դա որակի ապահովման դասընթացներ, որը շատ կարևոր է, որովհետև այդ դասընթացների ժամանակ էլ մենք մանրամասն անցել ենք եւ քննարկել, որ եթե մի գործի մեջ չկա որակ, այնտեղ չի կարա բիզնեսը երկար շարունակվի։
Մեկ այլ կարևոր բաղադրիչ է ցածր տոկոսադրույքով վարկ ստանալու հնարավորությունը։ Այն տրվում է բոլոր այն մասնակիցներին, ովքեր հաջողությամբ հաղթահարում են ծրագրի մասնակցության բոլոր փուլերը։ Մասնավորապես ներկայացնում են բիզնես ծրագիր եւ որակի ապահովման ծրագիր, իհարկե բոլոր դասընթացներն անցնելուց հետո, որոնք էլ հավանության են արժանանում գործադիր կոմիտեի կողմից։
Ֆինանսական մասը ուրեմն տրամադրվում է, որպեսզի մենք կարողանանք գնել բժշկական գործիքներ եւ սարքավորումներ, արդեն լրիվ հագեցնել կլինիկան համարժեք վերջի սերնդի սարքավորումներով։
Կապը մեր շահառուների հետ ինքն մշտական գործընթաց է, ինչպես մենք ենք իրականացնում իրանց այցելություններ, այդպես նաև ծրագրի ղեկավար դոկտոր Արմենյանը իր ամենական իր այցելությունների ժամանակ Հայաստան իր հետ անում ենք շրջագայություն ամբողջ Հայաստանում եւ այցելում ենք մեր շահառուներին։
Պետք է ընդգծեմ, որ գրեթե բոլոր դեպքերում բիզնես ոլորտի հետ առնչությունը շատ չնչին է լինում, այսինքն կան մասնակիցներ, որոնք արդեն գործող բիզնեսներ ունենում են, բայց հիմնականում մասնակիցները դասընթացի մասնակցության ժամանակ բերում են նոր գաղափարներ, այսինքն ոլորտի հետ որպես այդպիսի առնչություն քիչ է մնում։
Բիզնես դասընթացները, ասենք ինչ-որ բաներ, ես իմ աշխատանքների կազմակերպման ընթացքում արել էի, բայց բաներ կան, որ իմ համար ավելի պարզ չէ ռազմավարությունը նկատի ունենալ ուժեղ թույլ կողմերը, որոշ էինք մեր ծրագրում։ Այս պահին մենք 5000-ից ավել բնակչություն ենք սպասարկում, Թարմինում, այո, մեր սպասարկող բնակչության թիվը պատկերացրեք տարեստարի աճում է, շուրջ 1000 բնակչություն։ Մեր կենտրոնում գործում է տանեկան բժշկի կաբինետը, ներզատաբանի ծառայություն էնդոկրինոլոգի, նյարդաբանն է։ Այս ընթացքում այդ ծրագրի շրջանակում լաբորատորիան հագեցրեցինք մնացած լաբորատոր սարքավորումներով եւ այդպես մենք ունենք 4 տեսակի լաբորատոր գործունեություն, որը մեր աշխատանքների ավելի լիարժեք, ավելի համապարփակ է դարձնում։
Ես միջև Նարեկ բժշկական կենտրոնի ստեղծելը բոլոր անալիզները հանձնել եմ Երևանը։ Իսկ հիմա բոլոր անալիզները տալիս ենք Նարեկ բժշկական կենտրոն եւ շատ փոքր է։ Երևան մենակ կայցելենք շատ բարդ ինչ-որ ծառայությունների դեպքում։
Մեր կողմից նաև շատ խրախուսվում է կլինիկական օրդինատորների մասնակցությունը ծրագրին։ Կլինիկական օրդինատորները կարող են մասնակցել ծրագրին անգամ առանց նախնական հստակ գաղափար ունենալու եւ կարծես դասընթացներին մասնակցելով, ավագ գոլեգաների հետ, փորձագետների հետ շփվելով եւ իրենց հետ աշխատելով ավելի թրծել իրենց գաղափարը եւ վերածել հստակ ծրագրի։
Թե կրթության ընթացքում, թե աշխատանքի ընթացքում աշխատելով պետական հիմնարկներում մեծ փորձ, բազմապրոֆիլ հիվանդանոցներում աշխատելու, սակայն մի մաս կա աշխատանքի, դա ստեղծագործ մասը եւ գործելու ավելի ազատ հնարավորություններ բացակայում են պետական մասնավոր հիմնարկներում, եւ որը ավելի շատ մղումած է ծավալի սեփական գործունեություն, որտեղ կարող եք իրականացնել սեփական գաղափարները, սեփական նախաձեռնությունները։ Ես քաղաքացիություն մարզից եմ, քաղաքաշտարակից եմ, վերջնական նպատակը քաղաքաշտարակում ստեղծել պոլիկլինիկա, այսինքն անհատական բժշկի պրակտիկա կոչվածը, այսինքն զբաղվել մասնավոր գործունեությամբ։
Շատ կարևոր բաղադրիչ է, կանխարգելի ճարտարապետության բաղադրիչը։ Այս միտքը ծնվեց այն ժամանակ, երբ հասկացանք, որ ծրագրի դիմորդների մի զգալի մաս ատամնաբուժական ծառայություններ է մատուցում կամ ցանկանում մատուցել մեր օգնությամբ, եւ գաղափար ծնվեց այն բոլոր համայնքներում, որտեղ մենք ունենք ատամնաբույժ շահառու, շեշտը դնել կանխարգելիչ ատամնաբուժության վրա եւ վերին խորոչի հիվանդությունների կանխարգելման վրա։ Այդ ամբողջ ընթացքում շահառուներին օգնում են Ամերիկյան համալսարանի հանրային առողջապահ առողջապահության ֆակուլտետի այն շրջանավարտները, ովքեր առաջին կրթությամբ նաև ատամնաբույժներ են։ Մասնագիտական խորհրդատվության բաղադրիչը շարունակվում է նաև շահառու դառնալուց հետո։ Մասնակիցները հնարավորություն են ունենում համագործակցել Սփյուռքի նույն ոլորտի մասնագետների հետ։
Սփյուռքի բժշկական բուժքույրների, բուժակների ներուժը բավականին մեծ է, դրա մեջ նաև ներառվում է տեղագործներ, ատամնաբույժներ, հսկայական ներուժ ունեն եւ այս ծրագրի նորարարությունը այդ որ ներուժը օգտվում է բոլորովին նոր ձևով, մեր կապը պետք չի սահմանափակվի բարձրապես սարքեր ուղարկելով եւ կամ այդ մարդասիրական գործերով ուրեմն մենք ձգտում ենք որ կապեր ստեղծենք, որը պետք է կարողանա ընդհանուր առմամբ այսպես կոչված mentorship-ի միջոցով գիտության, գիտելիքների փոխանցում լինի, որի արդյունքում մենք հավատում ենք, որ ընդհանրապես բժշկության, բուժօգնության, ատամնաբուժական որակը պետք է բավական բարձրանա Հայաստանում։
Նոր բուժհաստատություն բացելու համար պետք է հաշվի առնվեն բավականին նախադրյալներ, որպեսզի կարողանաս կայանաս ծրագիրը ինքը հենց Turpanjian ծրագիրը այդ կանոնները լրիվ սովորեցնում է եւ թույլ է տալիս քեզ կողմնորոշվելու դու ճիշտ ես արդյոք ճիշտ ուղու վրա ես թե ոչ եւ արդյունքում ստացվեց այնպես որ մենք լրիվ արդեն պատրաստ ենք որպես գործարարներ սկսել մեր ծրագիրը պետք պատվերի այն ծառայությունները որոնք առաջ ես ուղեկրում եմ մոտակա բժշկական կենտրոնում տեղում ես հիմա դրանք կատարում եմ եւ այդ գումարը մնում է իմ բիզնեսին
նախապատվություն եք տալիս հեռավոր մարզերի, ինչպես նաև սահմանամերձ գոտիներում առաջարկները կամ բիզնես գաղափարները, որ մեզ դիմում են դրանցով։
Հաղթանակ գյուղում դեղատուն հիմնելով ես մասնակի լուծել եմ առողջապահական խնդիր համայնքի բնակիչների համար։ Ամենափոքր, ամենաէժանագին դրդներու համար իրանք ամենապակասը 10-12 կիլոմետր ճանապարհ են անցել։ Պլան կետ առ կետ մենք կարողանում ենք բիզնեսը կառավարել, հետևել բիզնեսին, իր ճիշտ ընթացքին, շնորհիվ ծրագրի դասընթացների։ Այրունից են գալի, դեբեդավանից են գալի, բագրատաշենից են գալի, անգամ շնողից, ճոճկանից, կուխվից, վերթավանից, նոյեմբերյանից են ունեցել հաճախորդներ։
Ես ինքան ուրախացել եմ, որ այս դեղատունը բացել եմ։ Առաջինը գյուղի ժողովրդի համար, ինձ ինչ պետք է մեծ կնիկա, ճշման դեղ, սրտի համար դեղ, եւ ավելի էժանագիները, քան իշտե այրում Իլինոյի Հարու դրամն էլ մեզ համար փոշակավորների համար մեծ նաչի։
Ծրագիրն անընդհատ բարելավման գործընթացի մեջ է, հիմնվելով ինչպես մեր փորձի վրա, ինչպես Turpanjian գյուղական համայնքների զարգացման ծրագրի փորձի վրա, միջազգային փորձի վրա, ինչպես նաև որ շատ կարևորում ենք մենք հենց մասնակիցների կողմից տրվող գնահատականի հիման վրա։ Եվ փաստորեն որակի շարունակական բարելավման գաղափարը մենք փորձում ենք ներդնել ոչ միայն մեր շահառուների գործունեության մեջ, այլ նաև հենց ինքնին ծրագրի մեջ։
Այս ծևով մենք կստեղծել ենք, դուք կստեղծեք ձեր ձեռքերով նոր որակ, նոր մոդեցում, նոր հավատ փորձի հանդեպ եւ ժողովուրդը ցեզի ավելի կվստահի։ Okay, Astrid, can you tell us something about what the AUA School of Public Health is doing over the past 6, 7, 8 months of this COVID epidemic?
in next 5 minutes or so, I'll try to summarize the main activities that AUA Turpanjian School of Public Health, or AUA SPH, was involved in within the framework of COVID-19 response. Well, first of all, let me highlight here that whenever we talk about AUA Turpanjian School of Public Health impact in this framework, it is not limited to only researchers and staff, but also includes AUA Master of Public Health program graduates, by the way, some of which have high job positions in the Ministry of Health, including the Deputy Minister of Health, the Secretary General, and others. Well, being honest, I myself was involved in a little part of these activities, though I am very much happy to present a tremendous amount of work done by my seniors. So keeping my presentation short and to the point, let me summarize that if we try to categorize the main activities conducted by AUA School of Public Health, it can be first of all, it was involved in technical and professional support to local health authorities. The Dean of Turpanjian School of Public Health, Dr. Arevhat&Ani, the faculty members, Dr. Arevhat&Ani, Dr. Kim Hekimian, as well as Dr. Shan Shekhartimian were involved in experts committee next to the Ministry of Health and participating in a variety of different meetings, discussions, and in strategizing the possible solutions to specific problems, specific issues. And since the School of Public Health has availability of trained public health professionals who are fluent in English and Armenian, many of whom, by the way, have medical backgrounds, served important role in terms of preparation of different materials. And I can highlight here the translation and adaptation of different guidelines, including clinical guidelines and management guidelines for the physicians and the managerial staff of healthcare facilities. The AUA SPH activities definitely included the awareness raising and educational activities, and of course, last but definitely not least, it was involved in public health projects and research. Okay, talking a little more going into more details about the awareness raising and educational activities, it was mainly in the form of translation, adaptation, and dissemination of different educational and awareness raising materials, not only for physicians or managerial staff, but also the general population. AUA SPH faculty members actively participated in different live discussions, webinars, and was very active on media and on news coverage as well, including TV program, radio programs, online media, and others. Here I have highlighted some of the examples of educational materials on different topics. By the way, it can be about safe behavior, about smoking at COVID-19, about how to have safe behavior for taxi drivers, how to make homemade masks, and many others. Another slide I have prepared summarizing some of the TV programs and webinars that AUA SPH participated in. Again, on different, we have discussions, seminars, TV programs. And by the way, AUA MPH program graduates also had active participation in those kinds of news coverage. Having my last couple of minutes talking about public health projects and research, you might have heard about multi-center sero-epidemiological investigation conducted among healthcare professionals working in a front line of COVID-19 response. It was conducted, so the main data collection was done in June-July 2020. And it included antibody testing and survey among those professionals. About 1,150 health professionals participated in antibody testing. And the results are already available, and we can say that about 15% of participants had antibodies against the new coronavirus, and this percent varied, was different in hospitals and primary healthcare facilities. In hospitals, it was about 18%, and in primary healthcare facilities, about 8%. And the study was conducted in collaboration with UNAIDS and the Ministry of Health of Armenia, of course, and it is going to be continued on a population level in collaboration with the World Health Organization and the Ministry of Health of Armenia. And another active public health project is related to the contact tracing program. It is conducted in collaboration with UCLA Fielding School of Public Health and has several components, including strengthening the existing human resources and structural capacities of the contact tracing system. It includes update of different guidelines, algorithms, and standard operating procedures of contact tracing and case identification, based, of course, on the best international evidence, and, of course, population awareness raising activities. To sum my speech up, let me tell you that probably you know the Ministry of Health of Armenia started some preparation works from the beginning of the year 2020, to the best of my knowledge. It was a couple of months prior to the first confirmed case of COVID-19, which was on March 1st. And AUA School of Public Health were actively engaged in COVID-19 response starting from the beginning of March.
Let's hear first Hracia Lilozyan, who's a MD graduate of the Yerevan State Medical University, but also a graduate of our MPH program. And he has a vast experience in the development of tuberculosis control programs in Armenia. At the same time, I want to highlight that Hracia is a repatriate to Armenia. He is born and raised in Cairo, in Egypt, and his father is the editor of Husaper, the local newspaper of Cairo. And Hracia is also married and very well established in Armenia. Hracia, kuchosket.
Thank you, Dr. Armenian, for the introduction. Hello, everyone. I'm very happy to be here today to present the COVID-19 cases of our EIH family medicine practices. So my name is Hracia Lilozyan. I'm a research associate at the Arevhat&Ani Center for Health Services Research and Development. I will start with giving an overview of the current COVID-19 situation in Armenia and talk about the experience of two healthcare centers, EIH beneficiary centers, one from Tallinn, Aragadzot and Mars, and the second one from Noemberian, Tavush. As Dr. Najarian already mentioned, currently we have in Armenia, as of September 10th, 11 a.m., September 10th, we have a total number of confirmed cases of 45,326 COVID cases, and out of which 41,233 have been cured. Currently, 2,908 are under treatment. The total number of tests that have been conducted since the beginning of the pandemic, 227,809, and unfortunately, we have 906 deaths. As you can see from the graph on the right, since the start of the pandemic in early March, we had a steady increase in the incidence of cases, reaching at its peak in mid-June, and then steady decline, partly contributed by the introduction of the lockdown, as well as the enforcement of public health policies, such as self-isolation, wearing of masks, compulsory wearing of masks, as well as social isolation. Now, the incidence rate has decreased in the months of July and August. However, it is projected that by the opening of the schools, we will have, and the start of the fall season, we will have increase in cases. Situation in Armenia is as follows with the cases of our two healthcare facilities. So the first one is the primary healthcare facility of Dr. Tamara Gevorkyan, located, as you can see with the arrow, located in the town of Tallinn, in the Mars of Aragadzotne, which is located on the on the western border of Armenia. The Narik Health Center, it is a primary healthcare center which provides primarily general practice services, as well as some specialized services such as cardiology, endocrinology, and also laboratory services. The total number of COVID-19 cases which have been registered in the catchment area population of Dr. Gevorkyan's clinic is in total 50 patients up till today. 54% of the patients are females and 46% are males. The first cases have been detected since May, and the mean age of the patients is 50 years old. The case of Arevhat&Ani Health Center in the town of Noemberian in the Mars of Tavush, which is located on the northeastern border of Armenia. The case over here is somewhat milder. So in total, in Noemberian, we have 16 patients, out of which 56% are females and 44% are males. The mean age of patients is 38 years old. Again, the first cases were detected in the month of May. Unfortunately, we have had only one fatality in Dr. Yaralyan's catchment area population, which was a 82-year-old male. This is all from our EIH beneficiary cases. If there are any questions, I would be happy to answer.
Our last speaker is Shan Chikhardemian, who is going to elaborate on what is our projected role in of diasporan physicians in the EIH program. Shant?
Thank you, Dr. Armenian. Thank you, Larry and AAHPO, for giving the podium to this initiative and hearing out all of our colleagues. I think for those of you who know me, I've been preaching for a while now about the need for us from the diaspora to change our mindset from charity work or mission work or short-term work into investing in ideas and initiatives that create a sustainable healthcare system, one that could exist long after a diaspora or all the diasporas has fizzled out. And I think there's no better example than the EIH program to highlight one such initiative. And to me, that's the driving force behind being involved in trying to help out as much as possible, though with a big caveat that life sometimes gets very busy and it's difficult to do so. But nevertheless, I'm very, very excited about this idea because it's one thing to say that we should not be doing charity work, but then it's a much more difficult question to answer. Well, then what should we be doing? And for a while, most of us would stall there, not knowing what to do. Is it going to Armenia and doing education? Is it doing research? But not all of us are able to, because of our jobs or for other reasons, be involved in those processes. But I think most of us, particularly the clinicians in the group, can definitely take on the role of a clinical mentor to healthcare providers and clinicians in Armenia. And by doing so, not only sort of satisfy our own need to engage and to give back to healthcare or to help strengthen the healthcare system, but really create sort of independent, high quality providers that already have the backbone and the framework and the support of the EIH program. And so I've been working closely with the EIH committee members on this call, as well as a few who aren't on this call, in trying to develop opportunities for healthcare providers to become mentors and to work one-on-one with EIH beneficiaries to provide our experience, both in the clinical field as well as those of us who are in private practice, to provide some guidance and mentoring on how to develop, build, increase those practices, particularly in rural areas of Armenia. But I think, again, I see this as a very bi-directional engagement. I think in doing so, if I can put myself in that position and mentor, say, a surgeon in a rural area of Armenia, not only am I contributing to that program, but I'm also learning so much about healthcare in Armenia. And I think that I really do think the mentorship is a two-way street. And I think that the more I learn, the more I interact with, for example, in this case, an EIH beneficiary, the more I'm learning about the healthcare environment in that particular region. And that is inevitably going to better even some of my other projects and initiatives that I would be involved in. So the main role for the diaspora thus far, though there may be others with other interests and specialties, is to be involved as a mentor. The area or the track that has been most focused and has had the most robust results so far are the dentist mentors. There's a group of dentist mentors from both the East and more recently, the West, and more recently, a few participants from the East Coast that have been able to and willing to provide one-on-one mentorship. But alongside that, also develop a team that is now working on developing the preventative dentistry or dental hygiene program that Dr. Armenian alluded to. And there's a lot of synergy that can happen with that team and a lot of potential that can develop from there, which includes developing more and more of dental curricula, not only in oral hygiene or dental hygiene, but in other subspecialties, and then involve some formal teaching for dentists from abroad in the diaspora, and ultimately some clinical work alongside our colleagues who are EIH beneficiaries as well. So in short, I think this is a fantastic opportunity and a fantastic model for those who believe in, understand that charity work can only take the health system so far. In fact, many of us believe it won't be able to take us that far at all. And then for those who are seeking an opportunity that really contributes to sustainable healthcare development and strengthening, I think this is a fantastic opportunity. The group in Yerevan, led by Dr. Armenian and on the ground by Hracia and Aslig is top notch. And I think will provide us an opportunity to, again, be involved, but also learn from these experiences.
We have Dr. Arthur Kubikin with us. He teaches dentistry at New York University, and he has been involved in trying to do programs in Armenia. Arthur, I was wondering what thoughts you have about the mentor program and what they're trying to achieve.
My concern is that since most of the problems are in the 900 villages of Armenia, I'm concerned that they are an underprivileged population, and that emphasizing private business, which is mainly in the main cities, does not help most of the people in the 900 villages. That's my concern, and I'm wondering, is there no way to provide mentorship to the dental professionals in the villages?
They are. Let me make something clear. What happened in Armenia since independence is that out of these three sectors, the medical sector, the dental sector, and the pharmacy sector, what you observe that the two sectors that improved their quality and their operation and then provided a higher quality of services and access are dentistry and the pharmacy. Now you can find drugs and pharmacies in most rural areas in Armenia, and dentistry is also providing the appropriate technologies on a private sector basis. Now, the problem, however, is, and we hope to emphasize that, is the medical field, which is very much locked down in the government services. And that's where we are having some success in developing these family practice centers in rural areas. Coming back to your question, even in the worst days of Armenia's economy, 70 to 80, these are World Health, the World Bank studies, 70 to 80% of the healthcare sector was financed through pocket, through individual, private resources, not through government, not through USAID, not through the World Bank. People continue to pay, but they used to pay from under the table in order to get the necessary, even in the government polyclinics. So we want to create a model that puts that money on top of the table rather than under the table. That's where it's going to work. Now, if we develop the practitioners who are conscious of the social needs, who have got this social commitment at the same time in providing good quality, the other sector of the population, which is a minority even in rural areas, is going to benefit from it. And the prices of the services in Armenia, as I said, are minimal. Everybody can afford. This laboratory guy is testing for less than what it costs to go to Yerevan and come to do some of the more complicated endocrine tests, etc. We want to make everything transparent, those funds have to come up into the healthcare economy.
I got involved with a clinic in the Avaraev section, Bagramian district, in Karakert area, Myasnigian area, and many areas in Armenia, in the rural areas at least, you can find 20, 30,000 people and not one dentist. In Avaraev, from Karakert and Myasnigian, they had to go all the way to Avaraev to have a tooth extracted. So I'm still concerned that the rural areas are poorly served at this point, whether it's because of the government or because of lack of funds.
Well,
but I also have a limited perspective. As public health specialists, you have a much better perspective.
Dr. Kubikian, I think one of the reasons why we don't have dentists, because dentistry in Armenia is essentially privatized. And you have to create the incentives for the graduate from the dental school to go to these rural areas to practice. The incentives are going to be economic. This guy has got family, he has got, to be able to provide a relatively good life, etc. The government is supporting, for example, some of our family physicians, but they are independent operators, they contract with the government. And that's the mixed model.
I'll be happy to help in any way I can.
So we'll be meeting in 2 weeks. Again, I want to thank Dr. Armenian for a wonderful presentation and organizing such a great, spirited AUA team. Hiracia was really awesome. Astrid, you're wonderful. I've been seeing your emails. It's good to be able to put the face to the email and the voice as well now. And any way we can help you with that, please let us know. On that note, I want to wish you all a good evening and have a safe and healthy next 2 weeks. And we look forward to seeing you then.